Good afternoon. My name is Claudine Lewis. I'm a respiratory therapy student. I'm going to go over some some mechanical ventilation stuff with y'all. So I've just turned on my Draeger Avita XL. So ideal body weight for this patient is actually like around 55. There we go. 55. Give an adult. Perfect. So it automatically kicked on the SIMV mode with a tidal volume of 3.8. Let's look at our settings. So tidal volume is 380. For me, I think it's like, let's go a little lower. Yeah, I know. Oh, not higher. So let's go around 300. 320, that'll work. Accept. Inspiratory time is 1 second. That's funny. It thinks the test line is breathing. Inspiratory time 0.85. Frequency 14. O2 is 50%. PEEP is 5. Pressure support is 5. Let's look at our alarm settings. So our high minute ventilation is right around 10. Our low is right around 3. Airway pressure's high is 40. High frequency is 35. Our apnea is 20. Dang. Well, apparently automatically goes to 20. The protocol here is 15. So I always have to change that and accept. Let's say we wanted to do a different mode. Let's do pressure control. Kept all my settings, that'll work. So we're now in pressure control. We'll reassess our patient, look at their ABGs and all of that good stuff. So let's say I wanted to give my patient a breathing treatment while they're on here. So my circuit has the T-piece on here. This Draeger has the ability to give it while the vent's going, so you don't have to worry about the extra flow. So I just hit the nebulizer button, acknowledge, and it will start giving the nebulizer. I don't know if you're going to hear the extra. Yeah. So I'll turn that back off. So we've got that back off. So let's say after their breathing treatment, they're coughing, they've got some extra secretions. We're going to want to suction them, maybe even lavage them a little bit. If we want to lavage, we have a nice little sterile thing here. We can hook up one of these bullets and do maybe like 1 cc of fluid just to help loosen that up and make it easier to suction. I've been told it's easier to hold your breath while you're suctioning. It keeps you from suctioning too long. So just jam that down in there. I have a hard time with gloves trying to get that down in there, especially on some of the smaller tubes. So, and on the way back out, you'll squeeze and suction. There you go. This one has the filter in it. Here's my test lung. Back here's my, oops, I dropped my patient and their lung. So I have my T-piece here. Here is my little circuit for an MDI. A little spacer. There we go. So they don't actually use MDIs here to prevent patients. I think some of the other students have the same issue. You would take the, shake it, warm it up just like you would any other canister. And there's a little tiny port right here. You would add, you would just take the canister out of the inhaler and squirt it into there. When you do that, you'll want to do an inspiratory hold. So we can hold that and get them to hold their breath. Let go. Give it a couple seconds to a second dose. Do an inspiratory hold. That works. All right. And we'll want to make sure we put that back together so we don't have that much more circuit to fight. So that covers all that. I did the suction, I did the nab, I did the MDI. So we would also want to do some mouth cares on my little tiny baby head. So this would attach to my suction, which I don't have in this room. So I could, just kind of clean around the ET tube. Make sure that the holder is still secure. Don't let go of the ET tube. I wish y'all could see this bad place off. There's a good view of the glove. That'll work. So just want to go around the ET tube and clean and suction. Keep it on one side, do the other side, then move it to the other side as well. Fantastic. I could also use these little fun swabs and do that way. They move the ET tube ever so often through their shifts so that the patient doesn't develop sores. And always double check the marking and make sure it's where it's supposed to be. Like if it's 22 at the lip, that it's still 22 at the lip and not 24 or 20, because you're either going out or coming in or, you know, moving it around. So here, mostly nursing does the oral cares. So I think that covers everything. All right, thank you.